My Lords, I wish to direct the House to my medical and research interests noted in the register. The Minister, in his excellent introduction to this debate, referred to the lessons from the 1914-18 war, and I understand that reference and have some sympathy for it. However, my friend the anthropologist Scott Atran has pointed out that there are certain dangers in using the terminology of war, because it tends to turn people towards various isms: racism, chauvinism, ethnocentrism, and xenophobic nationalism, exactly the opposite of the things that we want to find in our global community at the moment. In truth, a more accurate reflection would be to address the lessons of the 1918 to 1920 flu pandemic, which crossed the world and led to the death of tens of millions of people. But there are two things about that experience that are different from our own. One is that people were experiencing it immediately after the war, where tens of millions of people had died. And so, to some extent, we're emotionally almost numbed by the whole business of massive death. Secondly, unlike ourselves, who are used to antibiotics, vaccination, and an expectation that people will not die of infections, people at that time were very much aware that people died of infections, sometimes in large numbers. Now, my Lords, these facts contribute to what another colleague of mine, Dr. Kerry Solkovitz, the President-elect of the American Psychoanalytic Association, has referred to as the second pandemic of the moment, referred to really by the noble Lord, Lord Blunkett and other noble lords, a pandemic of anxiety. It's not that he was suggesting that this was an inappropriate or pathological anxiety. On the contrary, it's a very realistic anxiety, because what is ahead of us is profoundly dangerous and challenging, and we don't even know how dangerous and challenging. So anxiety is not an unreasonable response, it's a natural human response. However, it does produce problems in reaction. It leads some people to be so overwhelmed that they deny the reality. And even coming through London today in the car, and not coming by public transport for safety reasons, I noted still groups of people out on the street in much more than twos and threes, and not taking seriously the very sensible advice that they had been given publicly by the Prime Minister, ministers, and other experts. Sometimes it leads to people being paralysed by the anxiety so that they don't know how to deal with things, but it also often causes illness. Not just psychiatric illness and emotional illnesses of various kinds, but physical illnesses. So there will be many people who will be falling ill, physically and mentally, as a result not directly of the COVID virus, but because of the psychological sequelae of that. And there are many sequelae, not just anxiety. Reflect, for example, on what it is going to mean for many people, particularly older people on their own, to face 3 months or more without ever having touched a person or being touched by them. As human beings, the physical dimension of life is of enormous importance, and they will be losing that and undoubtedly reacting in ways we do not know, because it has never happened in this wise before. Many years ago, I was called to do work at a hospice where people were finding difficulty as staff in continuing their work. And it became apparent that this was because of the repeated, incessant, unremitting experience of repeated deaths of those that they were working with. Reflect for a second on what it will mean with health service staff who have been used relatively well to getting people better, to find that hundreds and hundreds of their patients will die. How will they manage psychologically as well as physically? And so I would like to ask the noble Lord the Minister how much thought has been given to addressing these problems. There are many other things that one could mention, but I say two. One is that there are in the voluntary sector, the private sector and the community sector, employee assistance programmes which have been relieving the health service of having to deal with many of these problems, and they're not going to be able to survive financially if there is not some assistance for them. Baroness Sheila Hollins, who's not here, has asked that we also remember, as has been mentioned, the problems for those who are vulnerable because of learning disability. And finally, because there will be more people who will be admitted on formal orders, can I ask the Minister, can we monitor how many more patients come in than would normally be the case on formal orders, so that we have a sense of the increased burden on the psychiatric services?
My Lord.